Good afternoon and welcome to Arkansas Children's Facebook Remote Live. If you joined us last week, we were with Dr. Williams. We had a little technical difficulty, but we are back. So we welcome you back and thank you again for joining us. Again, I'm joined by Dr. Williams. He is Chief Medical Officer at Arkansas Children's Northwest in Springdale. And today we're talking about a topic I think a lot of parents and caregivers and anyone who is watching can relate to. You've been exposed to someone who has tested positive for COVID-19. Now what? And I know we all have lots of questions about when to get tested, should we get tested, quarantine, and all of the questions. So Dr. Williams, welcome, and thank you for being part of our Facebook Live.
Of course, glad to be here.
So I think just the first question on everybody's mind is, what does it mean to be in close contact with someone who has tested positive for COVID-19?
That's a good question. And we would say anyone who's been within 6 feet of someone for greater than 15 minutes in a 24-hour period, so cumulatively. So if you're wearing personal protective equipment, a mask or similar, then certainly that would not apply. But for close contact, 15 minutes in 6 feet in a 24-hour period.
And if I've been notified that I was in close contact with someone who has tested positive, what should I do? What are the next steps after that exposure?
If you believe it was as we defined recently, a close contact, then you really should isolate yourself and what we call quarantine or self-quarantine for as long as 10 days. Now, if you want to get tested, you can get tested and come out of. It's still going to be at a minimum of 7 days.
Caregivers might have questions as to when they should get their child tested. I know my child was just exposed at daycare. What is that time window, and what should you do after your child is exposed to someone who is positive with COVID-19?
That's a good question. I would ask that you not bother with the testing until it's been 5 days since their exposure. There needs to be a certain amount of time before the viral load can get high enough in your nose and mouth for the test to even be able to sense it there. So you might get, if you went to get tested before 5 days, you might find that it's negative and not truly negative. So we would ask that you wait at least 5 days or until your child has become symptomatic or begin having symptoms.
That's good, because sometimes I know you are probably anxious after you know about the exposure, but it's important to wait those 5 days. If my child does test negative, if you do get the test and it's negative, can after that negative test?
Well, it depends on when the test was performed. If, as I said before, it was performed after 5 days, then at 7 days, if that were negative at 7 days, you could come out of quarantine. But again, if you haven't been tested, then you would just wait 10 days. And if you're not having any symptoms at 10 days, you can go back to your normal activity without testing after contact.
And I know this next question is on a lot of parents' mind. If one child is exposed at daycare or at school, do they need to keep all of their children at home and in quarantine as well?
Well, no. Those other folks in the home would be considered indirect contact. So you're then in contact with someone who's been in contact. Unless that child your child has become symptomatic or begin having symptoms, then there would be no reason to quarantine others. It would, though, be important if you can all do this. And I know this is hard to do, but try to isolate that child from other children in your home, because if that child becomes positive, then there's a good chance that others in the household will become positive if you haven't been able to separate them. And again, to what extent possible, I understand that it's sometimes difficult to do, but if you could at all limit one's exposure to other members of your household, that would be helpful.
Excellent. This is all really good advice. If you're just now joining us or you're watching, we are talking with Dr. Williams, Chief Medical Officer at Arkansas Children's Northwest in Springdale. We're talking about a very hot topic. If you've been exposed to someone with COVID-19, what should you do next? And we know everyone has a lot of questions as far as when you should get tested, when you should get your child tested. And it's Dr. Williams just stated it's important to wait those 5 days unless there's symptoms before you get tested. So let's say, Dr. Williams, I test positive for COVID-19. Who should I notify and what should I do next if it personally happens to me?
As I said, you certainly want to get yourself into quarantine. And while you're there, you can make phone contact or text contact to those folks that you've had contact with in the last 48 hours. So just sort of rewind the clock in your head and think back to all the people that you've had contact with that would count as a close contact so greater than 15 minutes within a 6-foot radius. It'd be important to try to reach out to those friends or family members. Now, of course, those folks in the store that you may have come in contact with, I hope you're wearing your mask when you're at the store. There'd be no reason for you to go back to the store because it's unlikely you'd be directly adjacent to someone for more than 15 minutes in that kind of setting. So you don't have to call grocery stores if you just become positive. But all those folks at your work or close friends or family members that you may have had contact with without a mask, it'd be important to let them know as well.
That's excellent. And now we're entering almost a year into this pandemic, and I know everyone's a little anxious as far as when they can return to normal activities and parents and taking care of their kids. What advice do you have just for looking ahead for parents to keep their families and their kids safe and healthy during this time?
Well, we're still going to have the same drumbeat we've been doing this whole time, which is please stay socially distanced, greater than 6 feet apart. Wear your mask and frequent hand washing. If at all possible, we really ask that you avoid large gatherings as well. We are experiencing a peak of illness now. I think Arkansas pulled together, did a nice job early on in their masking and social distancing. You're starting to see that wane a little bit. Everyone's getting fatigued. I recognize that. I certainly feel it myself, but it's now important more than ever to mask, socially distance, and wash hands frequently, avoid large gatherings than it ever was before because of the amount of disease burden there is in the community right now.
Well, Dr. Williams, we appreciate your insight and for explaining that close contact. Again, it's 6 feet for more than 15 minutes, and the testing is waiting 5 days unless there's symptoms for you or your family member. So we know that's a lot of numbers to keep in mind, but it's really important if we want to keep everyone safe and healthy during this time. So Dr. Williams, thank you for your time this afternoon.
You're welcome.
If you have a question about COVID-19 testing or anything that we've discussed today, please leave it in the comments below and we'll make sure to get it answered. But as always, thank you for watching and continue to stay safe. Keep that 6 feet distance, wear your mask and wash your hands and stay safe. And we'll see you next time. Thanks for watching.